All right, welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us once again this week.
Hi, good afternoon.
Good afternoon. My name is Dilshad Burman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat today. If you've been following along, the way this works is we collect your questions over the past week and we present them to the doctor today. She's never seen them before. This is all off the cuff. If you haven't had a chance to submit your questions, you can still do so under this live broadcast, and we will try to get to as many questions as we can in this short 30-minute period that we have with the doctor. For now, I'll start with our questions that we've been collecting over the past week in a little cache that I have over here. We'll start with vaccine-related questions because that's been top of mind for many, many weeks now. And then we'll get to all of the other questions as well. So, Doctor, are you ready to go?
Yeah, let's go.
Wonderful. Let's get started. We're going to start with Charliza's question. Charliza says, my wife had her first dose done on April 23rd and confirmed second dose on August 13 in the Cornell Community Center in Markham. On June 14th, which is a couple of days ago, she received an email from the Ministry of Health saying her booking for the second dose has been canceled and there's no explanation. We've called and waited for hours. No one to explain to us why. Can you explain what is happening? What can we do to book her second dose?
Okay, so I can't comment on why the second dose appointment was canceled, though I can say that that as of, if you had your vaccine from May the 9th or earlier, and Dilshad, you tell me if I got the dates wrong because it's constantly changing. You probably have a better sense of that. Yeah, and if you live in but you have to live in one of the hotspots, and I think York is one of them as well, where there has been Delta variants, then you can book your appointment earlier. Now, the best thing for you to do is to go, so you can go on the provincial booking site to book it. Now, I understand York may not be using that provincial booking site, in which case you would have to go to the York Public Health booking site in order to book another appointment. Now, that being said, there are many pharmacies that have vaccine or will be getting more vaccine. We know that next week, Ontario is going to get millions of Moderna doses, and those are going to be distributed across the province, and those are going to be a really good supply for people to get their second doses. Even if you got your first dose with Pfizer, you can certainly complete your series and get your second dose with Moderna. Those two vaccines are interchangeable.
Okay, wonderful. And then CV and Tina have similar questions regarding the myocarditis diagnosis in some young men after Pfizer. There's a series of questions, so I'm going to go through them because they're actually quite interesting. So let's start with CV. Should young men wait for more information before they get their second dose of Pfizer while health authorities are still trying to figure it out? I've heard two things: maybe don't get the second dose, or get it because the benefits outweigh the risks.
Okay, so the short answer is yes, getting that second dose, the benefits outweigh the risk. So that's the short answer. And the reason for that is because the Delta variant is looming. And, you know, we've seen what happens in the UK where, you know, they detect it and then all of a sudden it takes off. And so that's the reason why we're accelerating those second doses. This is what we know right now about the it's myocarditis and pericarditis. So it's inflammation in the muscle of the heart or the lining of the heart. The US CDC and FDA had a meeting last week, and they reported on their data, which was very similar to what Israel saw. More common among teens and young adults up to 24 years of age, more common in males than in females, more common after the second dose. And occurs within a few days, like usually within 4 days of that second dose. Now, the symptoms can include chest pain or trouble breathing, but the majority that were reported on recovered very nicely. They had mild illness. You treat it actually with NSAIDs, those something like Advil, you know, actually Advil works well to treat it. So they treated with medications and rest at home. So that's where we're at right now, but it's not clearly like caused by the vaccine. It's still being investigated. Now the CDC has another meeting on Friday. We'll get more information. So in terms of should you wait to get that second dose? Well, it depends on where you're at, you know, and if you're in a place that has the Delta variant, then getting that second dose may be really important because that second dose does provide that better protection.
Absolutely. And then the second part of this question, what are the risks and what should people look for or do afterwards? Like you mentioned, what is the treatment for myocarditis, and are there actually any long-term implications of myocarditis?
Okay, so the symptoms are trouble breathing, chest pain, palpitations, and so those are signs that you should actually go to your emergency department. It's actually, you can actually diagnose it with an electrocardiogram, with some blood work, and also sometimes with some other imaging. It is treatable. And so this is the part that we're still under investigation. Were all of the cases that might have been linked to the vaccine treatable? It seems right now, but that's the part that we still are waiting for some more information to provide that full picture.
Right. And doctor, are there any long-term implications of myocarditis? Is it like if you get it once, you're susceptible, it'll happen all the time?
No, that's not necessarily the case. We know actually that myocarditis and pericarditis is more common in young people, actually. It is a heart condition that occurs in young individuals, including young males. And the commonest cause for it can be things like viral infections. And so that's usually, so we actually see it, like it's not like it's a rare thing. It does certainly occur and you diagnose it, and usually caused by viral infections, including COVID. Like COVID can cause this as well too. So just because you got it once doesn't mean that you're going to be at risk in the future.
Okay. And then does the Moderna virus carry the same risks of myocarditis? Have there been cases of that after taking Moderna and not just Pfizer? Yes,
so that FDA data actually showed that after the second dose, there were definitely cases after Moderna. Maybe even the rate was slightly higher as well too. Now it's hard to know if that's really because Moderna, you know, it occurs more often in Moderna. Again, that's why we need to actually wait for all of the data to come in to make that full assessment. But yes, it seems to be, if it is a real situation related to the messenger RNA vaccines for now.
Okay. And then following up to that, is there anything that can be done before getting the second dose of Pfizer to reduce the risk of myocarditis, like boost the immunity or extra sleep, drink water, any of those things?
Yeah, it's a really good question. Again, we're still trying to figure it out. Like, is this caused by the vaccine, or maybe it's that people had a viral infection and that's what's causing it, and because we're giving millions and millions of doses. So, you know, if it's caused by an infection, well, preventing that infection will certainly prevent the myocarditis. Right. But we don't quite have much more to say than that.
Okay, and then this is the last part of the question. Between Tina and CV, they had quite a few. Should people avoid physical activity after the vaccine? You know, is that a precaution or does that not matter?
It's not, this is not caused by physical activity, no, but I think the important point is that if you have symptoms, don't ignore them, like do seek medical attention for that. Now, I think it's important to know that the number of cases that have been, that they're investigating is still small compared to the millions and millions of doses of these vaccines that have been given. And so I think that's important to put in context, because it's also, that's the comparison to also the cases of COVID and the people that end up in hospital or ICU because of COVID. So that's why we still say the benefits of getting the vaccine outweigh the risks.
Right. Okay. Let's go on to some live questions that we have coming in here. Cher asks, have we gotten closer to knowing how often we need to get booster shots of the COVID-19 vaccines?
No, I mean, there's no recommendation right now for a booster shot, except for that second dose, of course. That second dose is a booster shot. But beyond that, no, we don't have any line of sight for a third dose recommendation right now.
Okay.
And the reason for that, let me explain though, the reason for that is because the 2 doses are giving us good protection, and the 2 doses are still covering us from variants, including new variants like the Delta variant. The vaccines are still working against those variants.
Right, right. Okay, Denise asks, when will children under 12 be able to get vaccinated? Do we have a timeline on that?
It all depends on when vaccines are licensed in that younger age group. And right now, it may still take several weeks to months.
Right.
But I think, actually, can I just add to that?
Absolutely.
Is that, there was a study that was released this week from Israel that showed that actually in a house, if an adult is vaccinated, that actually protects the kids in the house. And so I think in the meanwhile, getting all adults in the home, anyone that has any contact with those younger children vaccinated, that's actually been shown to help the younger children.
Absolutely. That's actually really encouraging.
Yeah.
Okay, let's go on to some more live questions here. Rose asks, for those who took AstraZeneca for dose 1, if they have the choice for dose 2, what would you recommend? Would you say stick to AstraZeneca if they can get it, or shall they move on to mRNA?
I think, it's really a personal decision. I think there's a lot of good reasons to pick a messenger RNA vaccine. Like, I don't think you have to be worried about that at all. It's going to be safe. It's going to give you good immune protection, and it's also readily available to get a dose of that Pfizer and Moderna. And you don't have to run the risk of that rare blood clotting disorder. So for some of those reasons, that might be a good choice.
Right. And then lots of live questions coming in. Okay, let's go to Wings. What type of vaccine is the new Novavax vaccine?
The Novavax is a protein subunit vaccine, as far as I understand, and that's actually very similar to the flu shot vaccine. So it actually has the spike protein in it, and then your body develops an immune response directly to that. That's the type of a vaccine it is.
So is that what they call like a dead vaccine virus? Dead virus vaccine?
It's an inactivated virus. Yeah, exactly. But it's not the whole. No, it's not an inactivated virus. It's an inactivated it's a subunit. So it's a piece of the virus. Like the coronavirus has the spike proteins. It's just a piece, that spike protein, and that's what the vaccine's made up of.
Right. As opposed to the mRNA vaccine, which instructs your body to create the spike protein and then antibodies are created.
That's right. Yes, that's right.
Okay, and then let's move on here. Nala asked, I guess this is a federal question, but perhaps you have some insight, doctor. When will the 3 days quarantine be lifted for travelers?
You mean the hotel quarantine? Yeah, because right now it's actually 14-day quarantine for travelers. Yeah, it's a federal question. So, I mean, we certainly defer to the federal guidance for workers who are exempt for what all travelers have to do. And, I can say to you, though, that as we have more and more people vaccinated, as our COVID cases come down, I mean, we will be lifting public health restrictions, including border restrictions, including travel restrictions as well.
Mm-hmm. Absolutely. Okay. I'm just going to read this out as it's coming in. Marlena asks, I read on the provincial site that the new second dose appointments made from June 16th will be getting Moderna regardless of the first dose. If I keep my original second dose appointment, which is 16 weeks apart, made when I first received my first shot, will I get Pfizer like I got my first dose? Is there an option of not mixing?
Okay, so it's a really good question. It's just that the vaccine supply comes in week by week. And you'll remember, like, just even back, we just actually don't even know what we're getting until we get it sometimes. And so right now we got a big shipment, 2.5 million doses of Moderna in Ontario. Moderna is they're twin sisters, they're twin brothers. They're very, very similar vaccines, Moderna and Pfizer. That is the vaccine that will predominantly be available in the next week, maybe the next 2 weeks. There's no guarantee that just sticking with your appointment that you're going to be guaranteed Pfizer, because if we don't have Pfizer, we can't give it to you. So it's not that we don't want to, honor what you were booked for. It's just purely based on supply.
Right. And so in that case, if a second appointment is available sooner, then they don't need to wait for that 16 weeks. Just book it, even if it's Moderna.
Yeah, exactly. And I might recommend that actually, because, you know, if you're eligible for the second dose earlier, well, that probably means that you're in an area that might have the Delta variant. I mean, we've actually seen it all across the province, including in the far north, including in big cities like where I live. And so, you know, and we know with that variant that the second dose really does give you that additional extra protection. And it's not just, you know, second dose of the same vaccine. It's a second dose giving you that booster response.
Right, right. And then let's go to another live question here. Vashti asks, is there any way to know what variant of COVID a person actually has?
So if you actually got COVID, yeah, I mean, it goes on to test for whether it's the UK variant, or it looks like it will be, versus 50% of all of the samples are being tested for the Delta variant. So if your test is gone on to be tested, that result will be available in your file. But it can sometimes take several weeks to get that result. And so you could follow up with your doctor to see if there's anything available on the computer system on that.
Right, okay. And then we'll go back to our submitted questions for now, but please keep submitting your live questions. We will take them if we have time. So let's move on here to Tina's question. Is it true that there is a concern about young males' fertility being affected after the vaccine?
No, that's not true. And I know that I've been asked that many times, and I have not been able to find any clinical studies, any scientific studies to say that. So the fact that it's out there means that someone has made that claim without any scientific backing. And so, you know, I think there are a lot of very, very good reasons to get vaccinated. And there's no evidence that vaccination will impact fertility.
Okay. Okay, Mary asks, up to date, there are no official data published confirming the efficacy of mixing AZ and mRNA vaccines. If I am at 8 weeks of receiving my first AstraZeneca shot, and I have both AstraZeneca or mRNA available, which one should I go for? And if I opted for the mRNA shot, and a few days or months later, there's data that says the clinical trials are not in favor of mixing, what would be the impact at that time?
Okay, yeah, so this is why I say it really is a personal decision for what you want for that second dose. There is actually a lot of good data on the mixing schedules. You know, you're right, it's not necessarily efficacy data to compare, well, if you had AstraZeneca, or AstraZeneca and Moderna, or AstraZeneca and Pfizer, you know, would you be less likely to get infected? But what we do have is good data on the immune response, the antibody response following vaccination. Right. And that data shows that you actually get a stronger antibody response after the mixed schedule than you do with AZ.
Right, okay. And then this is one we haven't had before. Sonia asks, my son is 13 years old and has vitiligo, the skin condition. Is it safe for him to take the Pfizer COVID vaccine?
Yes, so having that skin condition is often an autoimmune condition, and there have been many youth vaccinated with autoimmune conditions, many adults also vaccinated with autoimmune conditions, and right now it's, you know, if you have that skin condition, you still want protection from COVID, and so I would still recommend the vaccine, yeah.
Moving on. Condor asks, why is it not more information being made public about any dangerous side effects of the vaccine? Are the dangers being hushed up, and is the public being misled?
I think we're being pretty transparent, actually. I think when we knew about that dangerous side effect of the severe blood clots related to AstraZeneca, once we found out about it, we were sharing that information. And I've just spoken to you about the myocarditis, pericarditis situation. That's certainly not as serious as the severe blood clots. It is, people are recovering. It is a milder illness, but we're being transparent about it. I think also you should note that on the Public Health Ontario website and the Public Health Agency of Canada website, they report the side effects following vaccination. So there certainly is no concerted effort to hide any of this information. And if anything, I think we're trying to give information even when there's no confirmed links, like the myocarditis, pericarditis situation. It's not a confirmed link, but I think we're trying to be as transparent as possible.
Right, absolutely. And also, I think a lot of the times it's where to find that information. I know you've mentioned the federal government is also keeping track of side effect related injuries, that kind of thing. It's just a matter of where to find that information. And most often what we do is we look at the websites. That's where everything is being published. We look at the Ontario website, we look at the Toronto website, and we look at the Canada website. And I think most of the information that is available from the government is all up there.
That's right. That's right. If it's available, it's posted.
It's up there. Yeah, yeah. All right. And then Jasbir asks, can transplant patients get the vaccine for COVID-19, and will there be any serious side effects? He says he's been staying home for over a year now. So would it be better for him to just avoid the vaccine? And are there any numbers to convince me to get my vaccine as a transplant patient?
Yeah, well, what I would first say is talk to your transplant physician, because transplant physicians are very clear that they want their transplant patients vaccinated. Because you're at such high risk, because you're on these medications that weaken your immune system. In order to keep your transplant, alive, you have to be on these very strong medications. And so you really, if you got COVID, it would be very, very serious. So whatever you can do to prevent COVID would be really important. And so actually, if you're a transplant patient, you actually qualify for 2 doses of the vaccine in that shorter interval.
Yes.
About a month apart. And that's because the first dose, you may not get the best protection because of probably the medications that you're on. And so that second dose is really important to boost you, but it is safe, absolutely safe.
Absolutely. And another live question coming in from Rose again. Will AstraZeneca offer a booster, or will all the booster doses now be mRNA? And this is actually related to another question we had submitted over the past week, is that when is AstraZeneca coming back? I want to stick with AstraZeneca.
Okay. So as far as I know, we don't have any plans for a third dose. And, if we have a third dose, will it only be Pfizer or Moderna? What about AstraZeneca? I actually don't have the answers for that. It's a really good question. You see a lot of the decisions or the availability of vaccines has been on supply. We actually haven't had much AstraZeneca to be able to offer it in a large amount. And so I think that's an important point. Even the Janssen & Janssen, it's been approved, but we have not had a supply for that yet. So, if you were, really wanted an AstraZeneca vaccine, well, that's a viral vector vaccine. Maybe in the future, we might have the Johnson & Johnson vaccine. That might be an option for you. But for now, if booster doses are required, I would imagine that most vaccine manufacturers will produce a booster dose, but I certainly can't speak on their behalf.
Right, absolutely. Another live question coming in, Linda asks, for the second dose of Moderna, will there be the same symptoms, or I assume she means side effects, as the first dose?
Yes, so it's about the same. Yes, that headache, not feeling well, muscle aches. In Moderna, some people had swollen glands, but we know that you can actually get that after Pfizer. With the Moderna vaccine, the one difference is about a week or so after the vaccine, you can get a very sore or heavy swollen arm, but that again goes away. It's a small number of people that get that, and that is probably one of the few ones that is specific to Moderna.
Okay. And then this is a good one. This person is anonymous. They ask, I got my first dose of the vaccine in Canada. Can I get my second dose outside of Canada because I have to go to Europe?
Yeah, you'll have to find out in the country where you go. I mean, I certainly can't guarantee or speak on behalf of the country. The one thing that I can say is that when you come back, I mean, even if it's been, say, 8 months or 9 months, you can get your second dose then. You wouldn't have to restart your series. As much as you can. Of course, it's always good to travel with the 2 doses. Yeah.
Yeah, and actually, on that note, our reporter Faiza Amin actually did a story about this yesterday regarding Canadians abroad who feel like they are currently in limbo, because if you're a foreigner in that country, for the most part, you're likely lower down on their priority list, especially if you're young and don't have any, pre-existing conditions, all of that kind of stuff. So really great story up on citynews.ca right now if you guys want to check it out. So sort of a cautionary tale regarding travel to other countries, because you don't know if they're going to give you your second dose or not.
Yeah, that's right. And here in Ontario, we have a very accepting policy, like anyone, whether you have OHIP, you don't have OHIP, you're, a visitor and you're here because you can't go back home. Yes, you can still get vaccinated here.
Yeah, absolutely. Another live question coming in here. Vito asks, I got my Pfizer dose, first dose on May 23rd. When can I get my second shot? So currently we said it was May 9th was the date right now.
Yeah, so we'll have to wait and see. Again, when they open up spots, a lot of it is based on supply, right? And so there's no point getting you to book your second dose if you're going to be booking it out until September, because we don't have supply to open up more clinics. So I think as more supply comes in, they can allow more people to book their second doses.
Right. And again, yesterday, I believe the Health Canada said that we will have so many millions of doses coming in over the next few weeks that ideally everybody who wants to get a vaccine will get fully vaccinated by the end of September. So that's really encouraging in terms of timelines.
Exactly. Yes. Very encouraging.
Okay. We have a few minutes, so I'm going to go back to our submitted cache of questions here. Judy and Anonymous have a similar question. If I have my second dose done and I'm fully vaccinated, is it still possible that I can have the virus myself and spread it to others? So does that mean that I'm protected, but other people around me are not protected?
Okay, so if you're fully vaccinated, well, congratulations. If you are, that's great. You've dramatically reduced your risk of getting COVID. There is still a small chance that you could get COVID. And in that case, if you got COVID, like symptoms of COVID, then you could spread it in that case. Now, I think part of your question is, well, could you have COVID without even knowing it and spread it? And it looks like the vaccines prevent against that. So they prevent against that asymptomatic infection and spreading the virus. I've heard people talk about shedding the virus. It prevents that. So you're less likely to spread the virus to others if you're vaccinated.
So vaccinating will protect you and ideally protect others around you, because you're not going to spread it.
Exactly. And if we go back to that study that I talked about in a home, right? If an adults are vaccinated and their children then become protected, that again speaks to that same concept, right? Yes. That they're not bringing COVID into the home, whether they have symptoms or not.
Right. Absolutely. And then here we go. Amy asks, I received my first AstraZeneca shot on April 23rd. I am 46. How soon can I physically receive my second shot of AstraZeneca? I want AstraZeneca, and shouldn't the province consider perhaps allowing those who want it to get it at a shorter interval?
Okay, so I think actually on the weekends, the policy changed, right? So now April 23rd, I mean, you're not quite at eight weeks yet. So I would just book your appointment for the eight week point so that you could get it then. Yeah.
Right. Okay, let's see. Okay, nothing live yet, but let's go back to these submitted questions. Karen asks, once you are double dosed and 2 weeks out from there, what are you able to do then with family and friends indoors or outdoors?
Okay, well, right now we don't have any recommendations for the individual. Like I know the CDC has them and says, well, if you're vaccinated, you can do X, Y, or Z. We don't quite have that. What we have in Ontario is the 3-step framework, and it talks about as a community, if we have this much vaccination rates, if our COVID rates are down, this many 2 doses, then we can move on to enjoy, the parts of the steps. In step 3, that's the step that I think a lot of people are waiting for. And that's when we need high vaccination first dose, higher second dose, low COVID rates, and then we can actually have some of those indoor gatherings, some of those things that I think people are really looking forward to. But that's right now the approach that we're taking in Ontario.
Right, it's more community-based. So doctor, just hypothetically, if two people are fully vaccinated, what exactly are the risks, fully vaccinated 2 weeks out from the second dose, what are the risks of them interacting sort of in close quarters without masks, if they're hanging out maybe they're driving somewhere together, are those risks substantially reduced, or are we still looking at, staying 6 feet apart, doing all of the things that we have been doing?
Okay, so I can say that the risks are lower than if you were not vaccinated, that's for sure. But again, while we still have COVID circulating in our community, the risks then become higher because of that. It's not because you're vaccinated. I mean, you're vaccinated, you have very good protection, right? More than 90% protection, but there's still that 10% that, 1 in 10 not necessarily protected. And so while COVID is still circulating, that means out of 10 people vaccinated, perhaps one might have symptoms or get COVID. And so that's why we are still recommending that you keep the distance, wear the mask, because our numbers still have to come down just a bit more. Yes.
Okay, and then just one more question here. Patty says, I am fully vaccinated in Florida. Can I come into Canada with a negative test result within 72 hours without quarantining?
No, unless you are, unless you meet the criteria for an exemption, or you're, like an essential worker crossing the border. If you're just a visitor coming to visit, you still have to quarantine.
Right, absolutely. And so we're just coming up to 1 o'clock now, so we're going to wrap this up. Linda, I do see your live question. We're going to save that for next week. The doctor will be back with us. Thank you, everybody, for joining us today. Thank you, doctor, for taking the time and having the patience to answer all of these questions. Thank you to everybody that submitted live. We will hold your questions from this week for next week when we see the doctor again. Thank you so much, everybody. Bye-bye.
Bye.